COVID came about, and obviously somebody needs to deal with how it came about, but I'm not talking about that. So in terms of COVID, COVID is a severe respiratory viral infection, and that's what it is. It's related to, it's a SARS category. There's been two other SARS viruses. So, and coronaviruses. So, I mean, in terms of COVID, the infectious disease community, medical community, completely had amnesia when it came to the history of treating severe respiratory viral infection. I mean, just like you could look at it as medical malpractice, but it was like COVID came about, and like all of a sudden, the medical profession is starting from scratch, like brand new. We've never treated severe respiratory viral infection before. We don't know what to do. Like this, I mean, it makes zero logical sense. My grandfather, Dr. Max Fox, he was an infectious disease specialist, world renowned, and at the beginning of the pandemic, I read a lot of his papers. And what it came down to is you have to, one, keep the inflammation down in the lungs, and two, prevent bacterial pneumonia. That's as basic as it gets. And when you look at doctors that have treated thousands of patients, and I've treated nearly 1,500 patients with COVID. About 400 or so were very high risk when it comes to the statistics of individuals at high risk for severe complications. Thank God we did not lose a single patient. Everybody recovered. It wasn't easy with some patients. We had to be very aggressive with treatment at times, but thank God we didn't lose a single patient, and only had to have one patient hospitalized. And that patient was hospitalized not because of the severity of their COVID, but really because they couldn't manage to take care of themselves in terms of keeping themselves hydrated and eating and really activities of daily living. It truly wasn't the severity of the COVID. Other patients had some pretty severe COVID, and we had to do home oxygen and home IV, IV in the office for IV hydration, or IV antibiotic for bacterial pneumonia. So, but when it comes to what happened with the medical profession, it just you can look at it in so many different ways, and there's different perspectives out there on why, but they lost it. And with that, they lost, really, I think to a lot of people, lost a lot of credibility. Without being able to learn from the history of treating infectious disease, severe respiratory viral infection, and prevent, the death of thousands and thousands of people, some would say it's criminal, but at the very least, it's very sad. You have, these so-called medical experts, on different medical boards and what have you, and they haven't treated a single patient. So you have these people, talking about what should be done, what shouldn't be done, what's misinformation, what have you. They haven't treated a single patient personally. So you have to go to the people that have treated thousands of patients, and what's working, what's not working. having these, spokespeople that haven't treated a single patient, and that's who, is going to be, in the media light and, what have you for, telling people what to do, what not to do, what to believe, what not to believe. Like, it's, no logical sense. And, if these people were smart people, they would just shut their mouth and, do what they know how to do, and that's it. So, right, like I said, so we've treated about 1,500 patients. Thank God, everybody is well. What's been the treatment? The treatment has been, 1, prevent bacterial pneumonia. So, an antibiotic, right? An antibiotic does not work against a viral infection, but an antibiotic prevents an antibiotic prevents bacterial pneumonia. This was done for measles, where they saw, you can find the case studies, where they gave prophylactic antibiotics to patients with measles, and they prevented 100% of fatalities. This is the history of infectious disease. So what did we do? We gave an antibiotic to prevent bacterial pneumonia. Doesn't do anything for the virus, prevents bacterial pneumonia. 2, you keep the inflammation down in the lungs. We know COVID produces this severe cytokine response. Nebulized budesonide. Budesonide is a steroid. Through a nebulizer, you breathe it into the lungs. It reduces inflammation at the site where we don't want the inflammation. Simple as that. Some people, they can't tolerate the nebulized budesonide. I've had a small handful of people that couldn't tolerate it, so you go with dexamethasone, an oral steroid. Keep the inflammation down in the lungs, keep the inflammation down in the body in general.